Hello, everyone. Thank you for tuning in to the New Mainstream podcast,
where we explore the impact of multicultural consumers on marketing and media.
I'm your host, Mario Carrasco, and co-founder of Think Now. Hey, everyone. Welcome back to the New Mainstream podcast. I'm your host, Mario Carrasco. Today, we're diving into a conversation at the intersection of marketing, storytelling, and health equity. Our guest is Nikki Hopewell, Director of Multicultural Marketing at Susan G. Komen. Nikki's career journey is rooted in storytelling. She began as a journalist, driven by a love for compelling narratives that connect people. That passion evolved into a marketing career where she's consistently used stories not just to inform, but to ignite change. At Komen, Nikki is leading efforts to ensure that multicultural voices, especially Black and Latino communities who have historically faced barriers to care, are not just included in the conversation, but are placed at the center of breast cancer awareness and advocacy. Super excited today to talk about her career journey, the role of storytelling in driving health equity, and the lessons she's learned in building partnerships and community engagement. Nikki, so excited to have you here. Welcome to the New Mainstream podcast.
Thank you, Mario. I'm really excited to be here. I'm honored to share a bit of my journey and the work we're doing here at Susan G. Komen.
Yeah, and I love the journalism aspect. I have a literature degree, so
Ah,
different writing, but writing nonetheless. And I feel like that's um, just such great experience to have, especially moving into marketing and where you're at now. So would love to hear about that. Tell us a little bit about um, your journalism background and how you ended up at Susan G. Komen.
so my career, as you stated, started in journalism. I was in print journalism, and it's where I really learned the power of storytelling, how the right story can spark a conversation or shift a perspective or sometimes even drive people to take action. Um, and over time, I realized that I wanted to take that skill and apply it to purpose driven work. Not that journalism isn't, because it definitely is, but just wanted it to feel a little bit different, working in a way that could help, I don't know, change systems or improve lives somehow. Um, and I think a turning point for me was I worked at a content marketing agency, and the CEO then was a public health expert. And so she taught us as content marketers, like the core value of public health and learning how barriers of all type, whether they're systemic or institutional, um, create terrible health outcomes for folks. And for folks in the margins, especially, and how that causes disparities. So the disparities weren't caused by choices people made. It was largely about access or lack of access. And so that realization kind of shaped my focus on multicultural marketing and then health equity. And like, long story short, ultimately brought me to Komen. Um, so now I get to use like marketing not just to inform, but to like connect people, that's my sweet spot. I love to connect people to life saving resources and inspire action that hopefully can change the future.
I want to dive a little bit into storytelling. I feel like that's something that's used so much, right? Like storytelling and marketing. But like to you, in your experience, what does storytelling mean, and what makes good storytelling? I mean, especially as it relates to health.
Right. So I think a lot of times we throw out health terms and they're just terms. It's just like words on a page, or, you go to a provider and they offer up a diagnosis and your mind sort of just blanks out. I think storytelling really allows people to connect the dots and feel and have a deeper understanding of a diagnosis or an experience. It also allows connection, right? It's not words on a page. All of a sudden, it's brought to life. And even if you haven't gone through that particular lived experience, hearing someone who has, it changes your perspective. It changes your worldview, how you move in the world. You start to think differently, like, huh, I never thought about that. I never thought how that could impact someone else and even how it could potentially impact me. And maybe, just maybe, I can think about things a little bit differently, how I move in the world, how I, go about my day to day. So I think storytelling is really powerful and empowering.
Yeah, and I'm also picking up too, just anchoring it in human experience versus terms, right?
Mhm.
Like
Mhm.
when you're talking about how, oh, that could affect somebody else.
Yeah, absolutely.
Yeah, I mean, if I think about, I guess, doctors or that have given
Mhm.
me the best care, it's people that have taken the time to tell me in in layman terms, which is a form of storytelling of like,
Right.
hey, this is why this is happening, and here's how you can improve it, versus this is wrong, all these
Right.
medical terms that I have to Google, and I'm like, okay, I'm not connecting with that.
Right. Yeah. No, I think you hit on a good point. Like stories and storytelling humanizes, for my work specifically, health equity. Um, we'll throw out terms or data, and data is important, right? It shows the scale of a problem, but I think stories make people feel or experience something. So, when someone hears from a survivor who looks like them or speaks their language or shares their cultural identity or experience, it creates that connection. And then connection builds trust, and trust opens the doors for lots of things, right? For people to take action.
Yeah. And then, so speaking of health equity, like obviously, I think at the core of your career and what you have dedicated to yourself to, and I think that's another term many people kind of know and maybe understand on a surface level, but tell us a little bit like why is what is health equity, and why is it so critical, especially in the work you do with breast cancer awareness and care? I know that's a huge
Oh my
that's a
gosh.
huge topic, but let's try to start to see what is health equity? What does that mean?
No, it's a great question. I actually love this question because I think sometimes people confuse health equity or equity with equality. And equality is when you give everyone the same exact thing, um, which is lovely, but it's not necessarily getting people what they need, which is what equity gets at, right? Equity is giving folks the resources and support they need that's specific to their needs. So, for example, this is an example I use quite often. If we were to give everyone a bike, and let's say it's a toddler or not a toddler, but like a kid who's maybe in like first grade, a woman, a tall man, and an individual with a disability. They're not able to walk, so they're in a wheelchair. If we give them all a two-wheel, handlebar, two-pedal bike across the board, probably the tall man will probably be able to use it the best. The small child is going to have difficulty. The woman maybe because the bar is in a different situation place, on the bike. The small child can't reach the pedals, and the person who can't use their legs can't use the bike at all, right? So that's you're giving things equally, but they can't use. Not everyone can use all of those items. Now, if you give the individual with a disability a recumbent bike that allows them to pedal with their hands, fine. If you give the small child a smaller bike that's lower to the ground, maybe with training wheels, that's great. The woman needs a smaller frame bike with that little bar that slants, right? And the tall man already has his perfectly set. So then, now we have equity. Everyone is able to ride a bike, right? Everyone has a bike, but each bike looks differently because each person's needs are different. And that's equity, right? Just making sure that people have the resources and support that they need, just to be able to thrive, to ride a bike, to enjoy their day to day.
And I mean, I think this is linked to, I mean, we talked in our call setting up for this about historical barriers, right? Where, I mean, specifically Black and Latino
Right.
communities, communities
Right.
like you mentioned on the margin outside of
Hmm.
that, um, didn't even receive bikes, right? Like,
Right.
so
Right.
just
Right.
like, can you talk a little bit? I think because I think it's important to frame the rest of our conversation. Like, what are some of the historical barriers that
Mhm.
to care that Black and Latino communities continue to face here in the United States?
So, equity, right, is when it comes to breast health inequities, breast cancer doesn't affect everyone equally. Black women in the US are about 40% more likely to die from breast cancer than white women, even though They're screened at the same rates, even though white women are more likely to be diagnosed. Black women are more
This
likely
is
to die
this is
from this
today.
today. Still,
Wow.
yep, this statistic still persists. Chipping away at it, right, through interventions, but by and large, that statistic largely doesn't change. Latino women are more likely to be diagnosed at later stages when treatment options are fewer and outcomes are worse. It's language barriers, it's access, it's not talking about it. It's having providers who don't speak your language, so you're not getting the proper information that you need or understanding it properly, or not having an interpreter brought in. And it's not just biology, right, alone. It's barriers, right? Those systemic inequities, the lack of access, the gaps in trust, right? Not being able to trust your provider. Sometimes a black person will go to a provider, and a provider will fall will fail them. I mean, literally fail them. Say, you know what, you probably need 3D tomography, or dismiss the and not give it to them. And know that they need it, but just be like, oh, that concern that you have, that rash on your breast that could be inflammatory breast cancer, it's probably just a rash. Like, go home and don't worry about it, right? But at Komen, we firmly believe that where you live, or what you look like, or how much money you make should never determine whether you survive breast cancer, right? So those disparities really keep people from getting the care and resources and support they need, which means their outcomes are poor, and they literally are losing their lives, particularly Black women and Latinas. Like, this is just unfortunately because the system is stacked against them. So we're working really hard to break down those barriers so that they can get access to quality care that they need.
And would love to share, like, if you can, share an example. Like, what's a campaign or initiative from Komen that specifically address some of these barriers?
Sure. So we have a program called Stand for Her, and it's capital H, capital E, capital R, and H.E.R really stands for Health Equity Revolution, because that's what we're really trying to drive. We're trying to sort of break the system up so that the individuals in the Black community, and this is a program specifically for the Black community, will get the support and care they need to support their breast health and to improve their breast cancer outcomes. So, what does that look like? It is basically a program that's designed with specific interventions to support the Black community. There's culturally relevant education. We have genetic counseling and testing materials that are in our language, meaning it's conversational. We break down terms easily. It features Black providers, Black patients on the actual material. We have what we call the Komen Patient Care Center, which has a helpline. When people call the helpline, and you say, you know what, I'm a Black woman living in one of the 10 cities with the worst outcomes. Memphis is one, Chicago another. Um, I need help. I'm drowning. I just got diagnosed. I have no idea what the doctor is telling me. I don't understand my treatment, my diagnosis. We have patient navigators who look like our callers calling in and can say, listen, I understand what you're up against. How are you doing emotionally? It's overwhelming. Okay, we got you. What's your financial situation look like? I can think I'm kind of underinsured and I don't know how I'm going to pay for this. Don't worry. Our navigators will help literally hold your hand through this entire experience so that you can get the proper care and treatment you need. I don't understand my diagnosis. Still got you. So we hold hands with callers in the Black community, in the Latino community. We have bilingual speakers. And we make sure that they get the support that they need until they're ready to let go. Meaning, when you say when, we're like, okay, but also remember, even when you let go, we're still here for you. We will still provide whatever support you need, any question you need. We will come to you with appointments. We will help you answer questions. We will help you get funding, connect you to resources. We have you. We want to make sure that you don't fall through the cracks, that the barriers that are normally in your way, we'll just keep batting them down until we get you the care we need. So that's one program, but I mean, we support all folks in the margins. So anytime you call the patient care center, if it's a language issue, we can overcome that. If you're a caregiver, please call. We can absolutely help you. If you're a caregiver to someone, you're like, I speak English. My mom does not. I can be a translator, but sometimes I can't be there. Like, what supports can we find, right? So it's that wraparound care. Those are the type of programs that we really put in place to make sure that no one gets left behind, that the outcomes don't continue to worsen, that things just get better for those in the margins around breast health and breast cancer. So,
Yeah, and I mean, I love hearing stories like that because it's such a case study on doing cultural marketing right. And
mhm.
it's a passion of mine, but I don't get to work too often on such critical issues. So the fact that you're literally saving lives is so amazing, and it's culturally relevant. And I'm wondering, do you have like a personal favorite like moment from where you directly kind of saw impact or inspired some action? Like, I imagine you have so many, but like, does one stand out?
Um, I will say that I work with a woman very closely who is on the marketing team. She's a breast cancer survivor, a Black woman, and she's young. She was diagnosed young. And she actually helped us before she came to work at Komen. She helped us develop the Stand for Her program and really build it out. But when she came on board, she had a mountain of medical debt. I mean, just the amount of treatment that you have to go through and the cost. And she had insurance. She had private insurance, good insurance. So when she first was onboarded, I was like, "Well, did you call it the helpline, the patient care center?" And she's like, "Well, I make too much money." And I was like, "What? No, they don't just throw money at you. It's wraparound care. Like they will support you in whatever you need." And so she's like, "Well, I'll call and see what they can do." It turns out that a navigator found a pharma grant that said, "We will wipe out X thousands of dollars worth of debt um, if you can substantiate with the paperwork from your treatments." So, of course, she had to provide a mountain of paperwork, but she got a mountain of medical debt cleared because of it, right? So, it's it's that type of information that generally you wouldn't have access to. I mean, when no provider is going to say, "Hey, you know what? I know you got a ton of medical debt. I know just the thing for you. I can connect you with," you know what I
I,
mean?
I didn't know. I didn't think you were gonna go there because like we don't think about that, right? Like
Right.
we're just like we think about the treatment and making sure you're
Hmm.
getting information, which is
Hmm.
critical.
Hmm.
But the money side of things, which is a whole other conversation,
Right.
you're gonna spend whatever you need to spend
Mhm.
to be healthy, and the fact that y'all could help someone, I mean, that's amazing.
It's
I didn't even know
this
that existed, to be honest, like grants
right,
like that.
and most people don't, right? And that's what the navigators are there to do. That's what the helpline is really designed to do, and that's really what Komen is set up to do, right? We don't want people to fall through the gaps, and yes, we do have Komen financial assistance. And if you're income eligible, then yes, you can apply. But if for some reason the applications are closed or you don't apply, it doesn't mean that we don't have resources for you. We can connect you to a ton of resources. Our navigators and social workers on this helpline, I can't explain the value. They are unsung heroes, right? They do a lot of heavy lifting behind the scenes. They do a lot of work around what I call the social determinants of health, right? It's people think that health is associated with going to a doctor. If you walk through those medical doors, then you're going to have health. Well, if you don't have nutritious food, or you don't live in, if you live in a food desert where there's you have to go miles and miles and miles for food, or you can't afford where you live, or you don't have a living wage, all of those things stack up against you and create more barriers to your health. So it is about making sure that all those other things, in addition to the treatment that you're going through, are handled, right? That's equity. That's making sure that people don't slip through the cracks and don't fall prey to the barriers.
You mentioned social workers. I know social workers, a lot of that heavy lifting is finding partner organizations, right? Because
Hmm.
Susan G. Komen is a big organization, but you all are partnering with other people. You mentioned this pharma grant. Um, so I'm curious, partnerships, community engagement are critical. Like,
Hmm.
how does Komen approach that? Like, who to engage in a community and when?
So um, partnerships are everything. We can't possibly do this work alone. There's just no way, and no one organization can close all these gaps alone, right? So we work with churches, our worship and faith program, creating um, ambassadors, volunteer ambassadors in faith-based organizations, patient advocates. We have an advocacy arm of our organization where we have folks who are in the trenches, lobbying on Capitol Hill, right? Sharing their stories. We have healthcare providers who we are in connection with, who are advocates in science, who are researchers, who are letting us know about ways that they're driving or advancing health equity, trying to break down these barriers. Community leaders, right? Trusted people in all of these areas who come to us and say, "Hey, we'd love to work with you." Um, we work with like Touch, the Black Breast Cancer Alliance. They're a small sister organization that is really encouraging clinical trials. So we work with them to help encourage folks to participate in clinical trials. Because a lot of times, folks in the margins, particularly Blacks, Latinos, they are not invited to participate in clinical trials. Sometimes they don't know about them. They don't think to ask. So I'm working with organizations like that. We have resources through our helpline that will encourage people. Hey, you want a clinical trial? Let's talk about it. Let's help you get connected to one. One of the biggest lessons we've learned too is that relationships have to be built with consistency. We can't just show up during Breast Cancer Awareness Month and pop in an influencer, right? Um, when communities see us showing up year round, sharing resources, listening, sharing stories, not just talking and talking at people, but like being in community with people, that's when real change happens. And that's really what we're good at. Well, one of the many things that we're good at, but partnering is critical. We can't do some of the things that we do. We have work that we're doing with J&J, Johnson& and Johnson, and people don't understand there's a connection between breast cancer and prostate cancer. What does that look like? If you don't know your family history, talk about it. Maybe you need to get genetic counseling and testing. Maybe you need to have those honest conversations. Well, Auntie Liz, she died from breast cancer. Well, yeah. Well, her brother also had prostate cancer. Well, maybe we should get tested. Yeah, because it could run in your family. The BRCA gene, mutation is a thing. But again, you got to get educated about it and working with partners who help amplify the message, help, spread the awareness. That is really, really critical to us reaching the folks that we need to reach so that they can get the education and then they can take action.
I think that's you just gave such critical advice for marketers listening in terms of partnerships, like being there year round.
Hmm.
One thing on the non-health side of things that brands fail is they'll just come in on
Hmm.
Black History Month,
One and done.
Hispanic Heritage Month,
Hmm.
and it's so frustrating. Like, doesn't mean you have to be, every day, but it's like it's. I think now more than ever, people see through these one and done type of partnerships,
Hmm.
and given how important these communities are to society, consumer. I mean, it's just crazy that it's still happening in 2025. So I think private brands, companies can learn a lot from what organizations like Susan G. Komen are doing in terms of showing up, being there. Um, I guess to build on that advice, like what are some things that like that companies can do to, or what are some things that Susan G. Komen does to kind of be in touch with these organizations throughout the year? Maybe you're not doing big campaigns every month, but what's a good way to just show, hey, we're here, we're, this is not a one and done type thing.
So it's a great question. For us, it's really about value alignment, right? Like how are our organizations aligned? We work with Telemundo, and during Hispanic Heritage Month, we really dive in, obviously. But throughout the year, we're always having conversations with them about, okay, well, we have Gabi Natale, who's a fabulous Komen ambassador and Would you like her to come on to a show, an on-air show, and talk about her experience of breast cancer and why she's all about early screening, and how it helped save her life, right? It's figuring out the connection points. We also have Komen scholars who are Latina, and doing incredible research in the health equity space, and just lining those two things up. Like, okay, well, we're going to highlight some Komen scholars, and not just during Hispanic Heritage Month, but maybe it's during Women's History Month because they're breaking barriers, right? They're doing phenomenal things. And Telemundo's like, oh, well, who are they? Well, Dr. Amelie Ramirez, like, let's highlight these women. So we did this like kind of campaign where they told their stories. Some of them are breast cancer survivors, and they all work in the breast cancer space, and they all work with Komen, and they're all doing incredible things in the research space to advance health equity for Latinas and other populations. And Telemundo was like, this is great. It was great synergy, right? And it just keeps things fresh and allows us to amplify on both Komen's and Telemundo's platform. We reach all the people we want to reach. So I think it's just value alignment. Like how are your missions aligned in your organizations, right? Telemundo wants to empower women, right? Mujeres imparables, like unstoppable women, making sure that they just stay unstoppable and they help move and they move forward. And so we're finding ways to flow into that, right? We have unstoppable women we can certainly, amplify, who are doing great work in this space. And so it's a natural synergy. I think finding those synergies and the ways that you align with your mission, and thinking outside of the box. Like we have specific channels, we have podcasts, we have our social media platforms. So we have blogs, or thinking of ways to amplify that way. Would you like to sponsor a podcast? Would you like to give us some patience from your side, J&J, and help us explain the importance of the BRCA gene mutation and how it can impact prostate cancer and breast cancer? Do you have a patient? We have a patient on our side. You bring us, let's bring them together and let's have a Facebook Live. So just thinking about things that offer authentic storytelling, marries the missions and amplifies the message, and spreads awareness and really encourages folks to dive in on that action part.
That's great. Yeah, because you're right. If your values are aligned, organically, there's going to be
Hmm.
opportunities there, and it's a
Hmm.
back and forth. And um, I think a lot of brands just look at it transactional, where they're like, okay,
Right.
this could amplify us, but maybe the values are aligned, and so that's why it's one and done. But if there's a real partnership there, there'll be opportunities that come up organically on both sides. That's a really good advice for marketers.
Great.
Um, so talking about what it's a weird time to be talking about cultural and multicultural marketing right now. So it's really good to hear that you're still fighting that fight. Um, Looking ahead, like what do you see the future of multicultural marketing? I think there's a lot of thought pieces out there that it's shifting into inclusion, and we can't use D and I anymore. Like, where do you see this all headed?
Um, I think that we have to move people from just being aware that something exists out in the ether, and really drive them to take action, because that's where the sweet spot is, right? That's where the opportunity is. We can't just tell people what's happening and then expect them to just jump in and start doing something. Like, that's just not going to work, right? So we have to create pathways to solutions. I really see younger generations, um, the millennials, the Gen Zers, pushing this forward because they expect, you know what? They demand authenticity, period, full stop, right? They want transparency. They want purpose from every organization they interact with. You cannot half step. They will find you out and come for your neck, right? So that demand is going to raise the bar. We're going to have to show up as brands, as marketers, right? And not just for healthcare, like across the board. That generation or those generations will keep us accountable. And I think that's really what is going to give us the biggest opportunity. We can't just say we're going to do something, we have to do it, right? show don't tell, and also make sure that we are, in addition to making people aware, being like, okay, now that you know better, do better, right? Take that next step. And I know that these millennials and Gen Zers and oh, they're just going to hold us accountable because they're not going to let us have stuff. They don't allow it, and they're going to call us on stuff. So you better be on top of your game. And in fact, like invite them into the conversation, right? Like it's not just talking at them, but include them and say, you know what, I need to hear your voice here too, because in the breast cancer space, unfortunately, younger people are being diagnosed more often now. So they have skin in the game. They have skin in the game now. So it would behoove us to listen to them closely, right? And ensure that we're not just like, okay, thanks for your input, and then walking away and not doing anything with it, but like really acting on the insights that they have because they're out there in the world who, I mean, they're showing up in a real way and they're going to expect you to do the same. So listen to them. Just listen, and when you become aware, you take action, and also as folks become more aware, drive them to take actions.
I like that point of view because being in it, it feels grim sometimes.
Mhm,
But you're right, Gen Z, they're they're so smart with their money in terms of
mhm,
where they're spending.
mhm.
And I mean, look at Target, right? Like
Oh,
it's an example of what you're saying. Like I was all about it. Gen Z was, and the moment that they flip flopped, it's like we're done.
yep. Oh yes. Oh yes. Yeah. You want to be a Costco, not a Target.
Right, exactly. I mean,
Right.
look at Costco, right?
Right.
Costco's doing it.
Yeah.
They're talking the talk. So
Yes.
no, that's totally right. Um, Switching a little bit, like I have a fun new kind of section that I've been doing with my guests is asking them what's inspiring you from a media perspective, either
Hmm.
podcasts or books or even Netflix shows. Like what are you listening to, watching, reading?
Um, so I love NPR's Code Switch podcast. It's smart, it's nuanced, look at culture and identity. Um, I did watch, and I don't recommend it, but I did watch Squid Game, the first season. I just finished that. And even though it is harrowing, it does like remind you that there's a shred of humanity left
Yeah,
somewhere, right? And even when it feels like you're in a sea of despair, just don't be afraid to challenge the status quo, right? Like I think that's so important because I think sometimes you can feel overwhelmed and feel like you don't have any agency, and you feel outnumbered. But I think not being afraid to challenge the status quo, um, and also realizing too about equity, which I think sometimes the Code Switch podcast makes me think about, like flipping something on its head. So, like, I think a lot of people perceive equity as charity, um, and it's not a handout, right? It's literally it's redesigning systems, right? It's breaking systems so that everyone has a fair shot at the best possible outcome. And that's it. Like it's that's it. Like flipping your worldview on things so that you become honestly a disruptor, right? You just start disrupting the status quo. I think that's where we kind of need to move to. And that's when I think about like code switch or um just disruption and thinking about things in an entirely different way. In the Black community, there's something called code switching, right? Where you're in a room and you sort of talk. You don't use vernacular or whatever. But as I've gotten older, I'm like, if I don't show up authentically as me, whatever that looks like, then how am I able to do this work, this purpose driven work that I'm so connected to and that I really want to do? I have to show up in the space authentically so that I can do the work authentically. Otherwise, what am I doing? Then I don't feel like I'm showing up as my full self, and I don't feel like I'm serving the way I'm supposed to serve and serving the community or the audience or the population that I am here to serve in the best possible way. And it's not always easy. I get it. It's very uncomfortable. But I feel like when you do it and when you do it authentically, that's where the reward will show up. And the people that you're trying to connect with will see you and they will recognize, okay, Komen's showing up. They're being authentic. I see them. I feel them. They're showing me that they're here for me. They're sharing my stories and showing me that I don't have to get lost in the shuffle. I won't get knocked down by these barriers. I think you just have to show up as your whole full self. And it's not easy to do these days, but I feel like the work we do demands it, just demands it.
No, that's I love that. I mean, I was gonna add, but I think that's a great place to just stop because it's great advice for marketers, researchers, just to be authentic. And I think that goes both personally, professionally, and if you're an entrepreneur as a company, right? I think it
Hmm.
was a journey for me and my business partner to show up and um, yeah, so that's fantastic. Thank you so much. If people listening want to connect with you, learn more about your work, like what's the best way to connect with you?
Hit me up on LinkedIn. I'm on LinkedIn. You can always reach me at Komen, N Hopewell at Komen.org if you want to reach out. I think we're in an incredible moment, a moment where people are just ready to have deeper conversations about all this hard stuff, equity, representation, access to care. And I hope that like my work, the work that you're doing, Mario, not only like helps people feel supported, but like just inspires others to push for a future where health equity isn't just a goal, like it's just the norm. And then the last thing I'll say is just I know we're all about data a lot of times. Learn the data, but don't forget the people behind it. Please just make sure that they're always centered because that's really what we're here to do to support the people who just aren't getting what they need.
Yeah, I mean, we got a lot of researchers listening to this podcast, so um, I think as a researcher, when you're in it, you just see numbers, and you got to remember there's people sharing their opinions, and so thank you so much. That's a great conversation, powerful. Um, Appreciate you joining us, and thank you everybody for listening.
Thank you for the opportunity to share and talk. It's been a true pleasure. I love the work that you're doing. Thank you for this space, for creating this space, Mario. It's really important. So it's a pleasure to be here. Thank you so much.
Yeah, thank you. Thanks to everyone listening in. To get more multicultural insights, check us out at thinknow.com and follow us on social media. You can also subscribe to this podcast on your favorite platform.